Well, we'll just jump right into it. I've got some slides to share, and as part of those slides, we're going to share out this deck afterwards as well. And the deck includes a couple GPT prompts that you can use and play with yourself as a artifact that you can take away from this. So we're going to talk about how to use AI to explore yourself, explore the mind. I labeled it as self-therapy, but truthfully, it's going to be a bit broader than that. Really quick, who am I? So on the left was old me, fancy startup guy. I spent 16, 17 years working at a handful of startups, ranged anywhere from uh, the very first startup I was at was the classic sort of quick scale up. And then in the course of 2 months, we went from 200 employees to zero and full bankruptcy and liquidation, all the way to the other end of spectrum with large multi-billion-dollar IPOs. And so I was not only a startup exec, but was also a venture capitalist towards the end of my career. And then in beginning really in 2018, 2019, as I was struggling a lot with my mental health while building my career, it eventually culminated in burnout and what some would commonly describe as sort of a spiritual crisis and a spiritual awakening, sort of a spontaneous collapse of my old identity and my sense of self and what I thought was important and how I viewed myself in the world, and then the emergence of basically a very different identity, which is sort of this other version of me on the right with much less hair, but still with a big smile on my face. This is actually taken. I was down in the Amazon, spending time with military veterans who have PTSD. That's one of the things that I do now in my mental health advocacy work. Is I'm on the board of a nonprofit that supports veterans with PTSD, and we bring them down to the Amazon in order to give them access to traditional healing methods, namely ayahuasca. And so that was me after spending a week doing ceremonies with some of the U.S. Special Forces folks. And so, along this fundamental change and transition in how I came to understand myself, was truly this around the world search for me to arrive at a deeper understanding regarding the human condition and why I had suffered so much psychologically, emotionally, and spiritually towards the tail end of my career, and uh, and towards the tail end of my late 30s. And as part of that search, I explored everything from I was in group therapies, individual therapies, trauma therapies. I'd done, as I mentioned, these more shamanic medicines and traditions, and I truly explored every corner of the world, from Africa to northern Thailand to different parts of the U.S. to down in South America, to search for the answers of understanding more deeply the elements of the human condition and how we can find our way out of suffering if we experience what ends up being for most people an inevitable crisis at some point in their life. And so that's me in a nutshell. And most recently, in the last year, I've been spending time with another entrepreneur as we've been working on an app that utilizes AI to assist people in that search for the self, in that search for understanding our occasional human suffering, and to search for the truth of how to make it through those difficult patches in life. And that's what I want to talk about today. And so, just as a brief sort of side by side comparison, the typical thing that we do when we're experiencing psychological distress is we reach out to a therapist or to a coach or somebody professionally trained in one way or another. And they usually have licenses, and they've spent many, many years in a classroom setting, and they've also spent many years in a practical setting, for example, conducting psychoanalysis on their patients. But the challenge with the traditional therapeutic model, there are many challenges, but one of the challenges is just a simple scalability challenge. if you look at the raw numbers today around the number of people just in the United States who indicate that they have some psychiatric condition and could use professional guidance, we would need somewhere on the order of like 30 to 50 times as many therapists as we have today. So it's just not feasible. And so this is just a quick side by side comparison that as I see it in terms of how I've used AI versus all these other traditional psychotherapeutic methods in order to help heal myself and make it through a rather difficult transition in my life. You know, clearly on the access side, AI is omnipresent. It's becoming increasingly omnipresent relative to a therapist or coach, where if you're in a very busy area, such as the Bay Area, it may take weeks or even months before you can find and get access to a quality therapist. The cost side, obviously, you know, you can spend $20 a month on GPT or $200 to $400 per session on cost. And if you look at the clinical literature regarding what they call the dose response rate, which is how many times might you need to sit and speak with a therapist before positive clinical outcomes are realized, depending on the literature you look at, but typically it's somewhere in the range of 10 to 20 times. So it's a significant investment financially and in terms of your time, and the dose response rate kind of has this like asymptotic curve where it takes a while for you to realize the benefit. Obviously, on the feedback cycles on the AI side, it's something that you can do instantly, for example, as part of a morning routine. Now, when I talk about mood and consistency, AI, you know, you can, as folks here probably know, you can set the tone and the language and the mood through which it interacts with you. And on the psychotherapeutic side, the mood and consistency is variable because, after all, therapists are human. All right. And they have very difficult human experiences as well. And I've had moments where I've sat in a therapist's office and I thought to myself, like, I think I'm doing therapy for this person right now. So sometimes you don't know what you're going to get. And then on modalities and styles, this is really what this conversation is going to be about and where I think AI is powerful. So I'll hold on that for a little bit. Emotion and connection, and the nonverbal cues, like at this point, this is where AI is still a bit limited. Obviously, I think that's going to improve dramatically fairly quickly. But when it comes to being a mammal whose nervous system is naturally attuned to being in connection with another human being, I still don't think that AI has any comparison to the human experience. And that's related to sort of this other point around crisis, which is like if you're in a state of crisis where the emotional turbulence is so profound that it's disruptive to maintaining your lifestyle, again, AI is not the replacement for that in most cases. It's go and spend time with another human being, ideally in a professional setting. All right. So some benefits and limitations, but as I mentioned, the modalities and styles thing is what I actually find is the most interesting. So let me get philosophical for a moment and to plant the context through which I'm going to speak about this. So this is a massive simplification of the world, but one that I think is generally and directionally true. So you have this spectrum of identity, right? On the left, you have a spectrum where it's all about the self. There is an ego there. There's an identity. This is more commonly ascribed to Western cultures, especially the more economically developed Western cultures. And thus arose the field of psychoanalysis. This is Carl Jung, one of the fathers of psychoanalysis. He's been hugely influential in my own journey. And the concept of this is that there has to be an ego, an identity, some psychological structure that defines this person's sense of self in order for there to be something to analyze, right? And so on one end of the spectrum, you have a deep rooted sense of self. There's a strong identity. But on the other end of the spectrum, which is more typically generalized to Eastern cultures and to native cultures from around the world, is that their worldview is that the fundamental issue is the existence of the ego and the identity to begin with. And so, whereas Western psychoanalysis says, hey, there's an identity there, and maybe that identity has a cluster of maladaptive beliefs and patterns of behavior, and let's analyze that identity and find ways to sort of edit that ego structure that serves you better in the world. The other end of the spectrum is saying, well, no, the very existence of the ego is the problem to begin with. That voice in your head that is constantly feeding you misinformation, that is negative, that is skewing your perspectives on life, that is the root of the problem. And so the objective is to, through meditation, through these practices that have been defined over thousands of years, find a way to eliminate or eradicate the majority of that identity, that ego, get it out of the way, and then something much more profound and calm and peaceful emerges from underneath that. So this is what I refer to as a spectrum of identity. And so the question is, which is right? What's the right approach? We often get hung up, especially when we're in this sort of seeking process of searching for the answers to our well-being. We often get hung up in this really more of an ideological approach to saying, like, well, this school of thought is right and this one is wrong. And the thing I have to say is that they're all right, just in their own way. And here's how. So 10 to the 15th power, that is a quadrillion. It's a really big number. And to root it in something a bit more tangible, for example, in the Milky Way galaxy, there's approximately 400 billion stars. Billion, not million, billion. And the typical galaxy has somewhere between 1 to 400 billion. That's pretty normal. A quadrillion is a million times greater than that. And why am I bringing this number up? And how does it relate to this sort of spectrum of identity, this self and no self? Well, these researchers, they asked the question, they said, you know what, how unique are humans? And so they conducted a bunch of analysis, and the way that they conducted is they said, you know what, let's model out the mathematical probability of the same sperm or the same egg, the fundamental building blocks of human reproduction. Let's model out the probability that genetically the same one is made twice, right? And just using that as a proxy for novelty. And the number that they arrived at was roughly 10 to the 15th power, a quadrillion. So there's a 1 in a quadrillion chance that the genetic material that ended up becoming me as a human being, there's a 1 in a quadrillion chance that that would happen again. And so for all intents and purposes, the point of this is to say that as a human being, you are truly unique, not only to begin with from a genetic basis, but then through the socialization of life and the unique experiences that you have, you are further made unique because no one has the exact same experiences. And even if you did have the exact same experiences as somebody else, because you are designed and built completely unique as a human organism, those experiences would be filtered through the prism of your own mind and your own unique biological markers in a different way. So that's to say that, like, you are truly unique, truly unique. And at the end of the day, then, in this search for understanding, who am I? On this scale between, am I somebody where I am served well in the world because I develop an identity, a sense of self, and I craft one that serves me really well in life? Or am I further along on the spectrum of, you know what, I'm actually want to eliminate this ego, this voice in my head. I want to move more towards, just for lack of a better term, call it monk mode. This is the essence of the question of, like, who am I? What is relevant to me as this 1 in a quadrillion? And this gets back to what I think what is one of the biggest and fundamental limitations of saying that the Western psychotherapeutic frame is the only frame through which people can move towards psychological wellness, is that it makes the assumption that within that method lies the truth for all people, lies the answer to the elimination of suffering for all people. And we just know that's not true. Nobody, no teacher, no guru, no method, no modality, no philosophy has a monopoly on truth or a monopoly on the ability to heal somebody. And what you can do though is you can look around and like this is just a grab bag of a few examples where, for example, in the world of psychoanalysis, there are all these different modalities like cognitive behavioral therapy, internal family systems, the 12-step method, which again is predicated on some amount of individual identity. There's entire fields around cultural and social psychology. There's dream analysis, positive. There's dozens of these, right? So there's all these different modalities that when you put them on this spectrum, you can say, okay, these tools for exploring the self and for understanding the self and for maybe alleviating psychological suffering, they tend to fall on one side of the spectrum. And then these other tools or methods like yoga, meditation, shamanic practices, like what I was doing with the military veterans down in the Amazon, various forms of old world mysticism, practices like qigong, right? The sort of ancient art of learning how to use energy in the body, psychedelic medicines. These fall on the other side of the spectrum, and this is again just a sample of the different tools as they play out across the spectrum. And so, really, when you're exploring the self, this is the question you're asking: who am I? Where do I uniquely exist on this spectrum? And what are the tools or the methods or the techniques that, that are going to uniquely work for me? For some people I know, certain forms of trauma therapy does absolutely nothing for them. But for other people I know, those exact forms of trauma therapy are profound. You just never know what's going to work for you. I had one of the largest nervous system releases of old childhood trauma through a method called auricular acupuncture, which was 5 needles of acupuncture put into each ear. I had no expectations that this was going to do anything. And then I spent the next 2 hours crying like I was a 10-year-old child again. you just, you never know. So you have to be open to the search. And what I find really interesting is that you can use AI as sort of like this broadest view of building a map in the search for myself, in the search for understanding myself at the deepest level. And this far exceeds the capabilities of any individual who may be an expert at a specific modality or a specific method of healing, but they don't have the capacity to be able to explore all modalities as part of your own search. And so this is what I use AI for, right? Is it's not that I think of it as a replacement for professional healers of some sort, but it certainly is a complement. So the intellectual framework that I have, or the mindset that I have, is that I use AI as basically my map. So I use it to sort of lay out this broad perspective, this broader view of what are the different philosophies or modalities or practices that I might explore where there's something there that seems and feels relevant to me. And then I sort of pull myself out of AI and then get myself into the real world and go and experience those. Nonetheless, it's like, okay, what are the prompts and how do I think about using AI in this way? And I break a prompt down into 4 components. So the first component is the intro, or what I call setting the frame. The second is specifying modalities within that frame. And then the third is who might the influential experts be that are relevant to those modalities within that frame. And then lastly, there's sort of what I just referred to as the invitation to share, because you have to share something of yourself, whether it's with a therapist or in the context of using AI, to then give enough appropriate background and context so that the therapist or the AI knows what they're working with. And so here's an example. I have a couple of examples. And this first one is from a Western psychotherapeutic frame, right? So this is setting the frame. And again, we're going to share this deck so that you guys can copy and paste these prompts and use them yourself. But I put a few parts of it in bold because these are really the parts that are the components of the frame that AI knows to work with, right? So you're saying act as a compassionate, pragmatic, and wise therapist, setting the frame. And typically, because it's the Western psychotherapeutic frame, it's about evidence-based, research-based solutions, right? It's not about what has been used for a couple thousand years within our cultural context. It almost always comes back to what does the scientific literature say, which has its own limitations to it, right? So this first part is setting the frame, right? It invites the AI to ask questions, sort of have this more open, positive perspective, work with me from a nurturing standpoint. The second part of it specifies modalities, right? So you're saying, I want you to be a therapist. I want you to use evidence-based methods, as far as we know, the stuff that is most directly provable and beneficial to people. And then I pulled out a couple that are very common specific modalities that tend to be used within modern psychotherapy. For example, internal family systems, dialectical behavioral therapy. You don't need to know what these are. If you're curious, you can dive into the AI and it'll explain it a little bit more. But it's basically saying be a therapist, use evidence-based methods, turn towards these specific modalities so that you can speak to me specifically from this frame. And then, and I bolded part of this again because you can edit this. And then it's like, okay, so use that frame, use these modalities, and then maybe from time to time, I want you to refer to the trendsetters, the deep thinkers, the philosophical leaders, some of the people that have made the most important contributions to this field. And again, you can edit this, you can change it as much as you want. And then the last part is invite to share. All right. So this is basically saying like, okay, hey, AI, I'm going to tell you where I'm at. And let's see if we can go through an example here really quick. Okay. So I put the full prompt here. Let's grab the whole thing. Let's copy and paste that in. Let's throw that in GPT. Okay, there it is. And you'll see that it's asking, okay, tell me about your background. Let's just do a quick demo. I am in a place in my life where I'm a bit confused. I'm torn between service work to help others with mental health, but at times I feel no motivation to do that. I feel an internal resistance. Maybe it's fear, I'm not sure. And you guide me on that. And then you'll see it basically starts to unfold in a pretty meaningful way, right? So again, using the Socratic method, it's sort of posing questions back to me so that it can sort of dig a little bit more deeply. You'll find some mentions in there. There it is. So acceptance and commitment therapy. So it's pulling in some of those specific modalities. It's making references to Carl Jung. Oh, this is interesting. He once said, until you make the unconscious conscious, it will direct your life and you'll call it fate. This is actually my favorite quote of all time. And so this is just a teaser. It gives you a sense as to what this can do. So what I've also done is pulled together an example from the other end of the spectrum, right? So we had the psychotherapeutic frame, and now let's say that Taoism is something that I feel a natural allure or a relation to. I've read some of its stuff at a high level, and I feel philosophically aligned with it. And so what if I wanted to use AI to make a similar exploration into myself? Well, here's an example of a full prompt. I won't run through it right now, but it uses the exact same format, right? It sets the frame in this first paragraph. It then speaks to the modalities in the second paragraph that are relevant to the frame of Taoism. And then it calls in the third paragraph, specific experts, for lack of a better term, or influential figures And then the fourth, again, it invites to share, because the sharing part is always essential. You have to give it something to work with and let it know where you're currently at. So you can do the same thing with this prompt, right? You can copy and paste the whole thing, throw it into chat, and you should end up having a similar experience. All right, so it's giving a prompt to share, and then it will unfold in a similar way where you'll tend to get answers that speak to the frame, that speak to the modalities, that speak to the experts, and so on. And the thing that I find the most powerful of all of this, one quick point, and I mentioned this earlier, which is on this journey, when you're searching for a deeper understanding of oneself and trying to alleviate any psychological suffering you have, one of the major traps, especially for folks like ourselves whose job is to be intellectual, who have been rewarded in the past for being the smart kid who got good grades, the trap along this journey is that you over intellectualize the problem. And what I mean by that, and why I mentioned like AI is really good for creating a map. At the end of the day, if you're sitting there and you're reading all the books and watching all the videos and studying all the philosophies, you may know a lot, but that knowing may not fundamentally change how you are feeling. And so you have to take that knowing, put the AI down, put the book down, put the video down, and go and apply it to your life. You have to live it. And through living it, you will feel and experience the benefits if there are any. All right. So I just want to point that out really quick. Now, this last thing, and then I'll shut up so we can get into questions. I call the combinatorics of human wisdom, which is, let me just share with an example. You know, in 1975, there was a physicist named Fritjof Capra. He wrote a book called The Tao of Physics. He was not only a prominent physicist, but he was a practicing Taoist. And what he noticed through his ongoing research in physics is he said, wait, hold on a second. These 5, 6, 7,000-year-old teachings, philosophical teachings from Taoism, have remarkable parallels with modern physics, especially quantum physics. He wrote an entire book about it. This is just 4 simple examples. You know, Taoism speaks about the interconnectedness of all things, right? This is coming from the school of what's generally referred to as non-duality, meaning typically we think of I am me and I am separate from the entire world around me. These other schools, these schools of non-duality, that are focused on removing the identity, removing the ego that is the root of this sense of separation from everything else. They talk about no, everything is all part of the same sort of unifying fabric, if you will. And then quantum entanglement, and actually one of the most recent Nobel Prizes actually proved entanglement to be true. You can change one atom over here, and then a million light years away, there's a ripple effect on that atom over there. Or it speaks about the Tao as sort of this ever-present, omnipresent source of energy that if you learn how to tap into it, then the Tao transforms you as a human being, and this is sort of the fundamental life force through which you live. Quantum field theory is validating the same thing, or the classic symbol of the yin and yang, the union of opposites. It's no different than wave particle duality. It's neither a wave, like matter is neither a wave nor a particle. It's sort of some strange, interesting combination of both. And so you don't speak it about it in that way. You understand the dualistic nature of reality, or Wu is the void, which we generally refer to as dark energy, which makes up 96% of the knowable universe. The other 4% is what we speak of as sort of like this glommed together physical matter that makes up stars and planets and what have you. The other 96%, we astrophysicists will just generally say, like, yeah, let's just call that dark matter, dark energy, which is just a label for we have no idea what it is. So there's something really interesting. Sorry, I'll hop back into this, where I talk about the combinatorics and I have a prompt for this, where you can then say, like, and this is beyond what a therapist can do. in this search for understanding the world, in this search for understanding the self, sometimes you find these profound insights that come through the combination of what appear to be completely unrelated fields of wisdom, like quantum physics and Taoism. And there are many examples of this. This is, for me, one of the most fascinating parts of my sort of personal exploration around understanding the nature of reality a bit more deeply. And AI is really, really good at this. You can give it prompts to specifically say, like, okay, here's the thing I'm exploring. Help me pull from multiple fields of knowledge and wisdom that may seem unrelated on the surface, and then start connecting the dots for me. So, anyhow, that's it. I'm going to stop there. I'm going to stop sharing, and uh, we've got some time for some Q&A. That's my spiel.
Awesome. Thank you, Andrew. I can hop in and share some of the questions that folks have submitted. Let's start off with this question submitted by Tatiana. So Tatiana says, I can see how AI can be used for highly educated and knowledgeable people in psychology, but how does it help you in the search journey? So you talked about how for some veterans with PTSD, one approach helped, the other did not. You've shared some specific prompts. Um, but what about being an open book and actually exploring and finding an approach or different technique that you were not aware of? How would you use AI on that search journey?
It's I've used it specifically for that, which is to, especially on the combinatorics side, that's where it's been most eye-opening for me. Is it made me aware of, for example, modalities and philosophies that I didn't even know existed. So, and that's what I mean using it as a map. It's like as I engage with AI and I use these more advanced prompts and I continue to ask it questions and go deeper and deeper, it will sometimes introduce me to experts. For example, I learned about Alice Miller. Alice Miller wrote a book called The Drama of the Gifted Child. The Drama of the Gifted Child, when I read it, I was like, okay, Alice Miller wrote this, I don't know, 50 years ago, and she basically described me to a T. And so that's what I mean is like, I find, especially these combinatorics prompts, is it introduces me to things that I basically stumble into, new experts, new resources, new tools or modalities that I just didn't even know existed. And that when I sat in a therapist's office, which I did for years, again, like when you work with a therapist, it's like anyone that produces a PhD. A PhD is an incredibly deep look at a very narrow topic. Generally speaking, PhDs aren't these systematic views of large complex systems where they're trying to paint a broad picture to help you understand something at a wider scale. And so when I work with in therapy, it's like that very surgical, defined approach. And by the nature of their license, they're not allowed to speak outside of that frame. And so I went through years of therapy, but like I still had a very limited, narrow view of actually all of the different tools and philosophies and modalities that were available to me. AI, I've used it with these prompts to actually sort of widen the aperture of all of the tools that are available to me. So again, I come across something on AI that I'd never heard about before. I immediately hop out of AI and I apply it in real life and I see, like, is this relevant to me? I hope that answers the question.
We've got another question that kind of is a good segue in terms of what to do. So Anne shares that they're also in growth. They ended up burning out because of PTSD and not feeling enough and trying to work their way into feeling like they're enough. They'd like to know a little bit more about the over-intellectualization bit. They've spent years trying to understand the root cause and it has helped, but how exactly do you go do the work? Does Can AI tell you what the work is or what to do?
That's a great question. Very relevant. I had complex PTSD diagnosis from my own childhood traumas and abuse. And so this one's very relevant. I appreciate the question. Thank you for sharing that. my experience has been that talk therapy served the function of creating a map similar to AI. It can kind of show you like these are all of the potential areas to explore. But at the end of the day, you have to put that map down, put your feet on the mountain, go walk those trails and explore it, right? And what I found was that, especially being a man, where my uh, the more typical male quality of valuing intellectualization of everything and not feeling emotions, right? But this extends beyond genders. This is really for anyone who's been praised their whole life for being the smart kid, and so you lean into the world with intellect. And we get caught in these traps on the search of over intellectualizing by saying, if I just learn one more theory about childhood trauma and adaptations, if I just watch one more video, that the intellectual knowing will be the answer. And it's not the fundamental answer. The fundamental answer is at the level of feeling and emotion. And so similarly, I lost my mom when I was 10, and she died from her own mental health issues. And there were a lot of traumatic circumstances around that I was there and I experienced. And when I went through this process and this search myself, it was helpful for me to learn at the level of intellect, like, okay, what types of therapies are there that are available? What cognitive behavioral tool might I be able to use in a moment where I'm feeling triggered? But the thing I actually had to discover and experience over and over again was the pain from those traumatic experiences. The emotional pain was still literally trapped and held in the body. We don't think of it this way, but Bessel van der Kolk, who's the author who wrote the book The Body Keeps the Score, it's the perfect title because it nails it. It's the the traumas, the difficult emotions, the abandonment that we've had in the past, these less than nurturing experiences, our body actually ends up being the repository for it. We hold on to it in ways we don't realize. Sometimes it manifests as like tension in the jaw and in the neck or in the back. Sometimes it manifests in more acute chronic illness, like treatment resistant depression or anxiety, or even chronic physical illness like irritable bowel syndrome, multiple sclerosis, early onset arthritis, and various forms of cancer. Because what happens is when you experience those traumas, it effectively turns on the fight or flight system of the body and it stays stuck on. And during fight or flight, the brain is then releasing all these stress hormones into the body, preparing it to fight or to flee. But since it's stuck in that mode, it is washing all of those hormones into the body repeatedly, which over time they degrade the body's natural vitality. And this is where both psychological and physical chronic illnesses have a direct connection to trauma. And so for me, I found certain forms of breath work that were really effective at actually uncorking old grief and anger I was still holding on to and having like 1, 2, 3 hour long emotive expressions of it. Again, the auricular acupuncture, that was a physical body based experience where as soon as those needles went in, my nervous system switched on, my teeth were chattering, my body was shaking, I was sweating, a full nervous system reaction. I found certain forms of meditation did the same thing. This is what certain psychedelics have done for me. So I guess the answer is like, it's about finding our way towards the physical modalities that allow us to express the pain that we're still holding on to, that our psychology, our ego has trapped. In my own case, under years of being Andy the Achiever, right? That was a defense mechanism of if I'm a perfect kid, maybe I'll get showered with love. And so I became that perfect kid until the weight of that was too fucking much to hold on anymore. And then you got to let that armor go. And when you do, you got to let the emotions come out. that would be my answer to it. You know, I'm happy to chat with you offline about this as well. So, you know, I could share my contact info. There's a lot of information to cover here, but this has been a big part of my 5-year search. So thank you for that question.
I know we're at time, but Andrew, do you have time for one more question? A little bit of a big one.
Sure, I have plenty of time. And just so folks know, if we want to hop out from this and do a separate real-time Zoom where I can do more Q&A, I'm unemployed right now, so I have I have plenty of time.
So I'll ask this one last question for everybody. So this is from Alex. And to set the stage, Alex works with AI tools and has often pushed that and to highlight therapeutic use cases as they find them to be one of the least known yet impactful use cases. However, oftentimes people are wary of highlighting these cases due to the sensitivity around it. And Alex uses the ChatGPT voice mode and has been able to ask it psychological questions as a therapist. Fantastic. But they wonder, given the sensitivity around therapy and, say, the critical states that some people may be facing, and how Gen AI tools could lead people to a poor state of mind by guiding them wrongly, not on purpose. Given that, what, if any, ethical dilemmas do you see with Gen AI's role in therapy?
Yeah, it's a great question. Um, there definitely are dilemmas. Um, there are dilemmas on both sides, ethical and philosophical dilemmas on both sides. Um, and I'll try and speak to both fairly quickly. I think that right now, AI is no replacement for getting in the hands of a really talented, empathetic human being. And when you can find that talented therapist, for example, um, I view that as the primary resource, again, because if anything, we're mammals, we're wired for connection, and an awful lot of the healing experience happens in relation with other people, especially if you had psychological wounds that are fundamentally relational in nature. As I mentioned, you know, the death of my mom, and it was a very rocky relationship because of her own serious mental illness. And so at the core of it was a relational trauma, my relation to a primary caregiver. And we carry those relational traumas later on in life into adulthood. And the only way to heal relational trauma is in the context of relationships with others. You can't heal it by reading a book or just knowing the theories around it. You have to engage in those relationships with others and then allow all of those uncomfortable, maladaptive behaviors and feelings and all come to the surface, because that's the arena in which you renegotiate and rebuild uh, relational narratives. And so I think uh, a large philosophical risk of AI is that you end up over intellectualizing, because then you just stay at an intellectual type conversation with the machine. And it doesn't attune to the human nervous system in the same way that we automatically do, positive and negative, in association with another. So, for example, when you're working with a therapist, there's a concept that they are rigorously trained on that is called transference and countertransference, which is a fancy word for saying, like, sometimes when you're talking with another person, they say or do something that triggers you, right? Like maybe it reminds you of that overbearing mother that you had, or that narcissistic father that you had. And that's a really important part of the psychotherapeutic relationship, actually, not only for the patient, but also for the therapist, because what they're paying attention to is what are the subtle or sometimes not so subtle responses or reactions that you're generating that are actually a reflection of how you're reacting to just them as another human being. And sometimes they accidentally do the same thing. They transfer their bullshit right back onto you. Which is why a huge part of becoming a therapist is basically you go through years of therapy in a clinical setting because you gotta battle your own demons first, right? Or hopefully you have. Not a lot of therapists have truly done that though. They've bypassed a lot of it. So I think that there's a major risk, and that's why I pointed it out in the slide, of the over intellectualization of this whole search, but especially within the AI side. So that's where I say, like, keep AI as the tool for the sort of high level map building. Oh, this is something for me to explore. Now put the AI down, go and interact with other people, be in the world, right? That is the ultimate healing experience, is right here, right now, feet on the ground, experiencing what I'm experiencing, positive and negative. Obviously, there are the information risks. You're putting information into a machine, that machine is storing that information somewhere. Um, but there's also a philosophical risk on the psychotherapeutic side because, and this is a big risk, and this is still something where, like, I'm navigating this myself, but the big risk that I see philosophically is that the Western psychotherapeutic model is continuing to move in the direction of what I think is medicalizing the human experience. What I mean by that is, like, let's say I go into a therapist's office and I talk about, I'm having panic attacks and depression. I don't know what's going on. All these old memories are flooding back. I'm having nightmares. I'm sweating. And they say, you're having panic attacks. Okay, what's going on? And then through this next couple of weeks, they diagnose me with obsessive compulsive disorder, generalized anxiety disorder, 4 other things, right? So I get all these labels thrown on me. And what can happen is that then, going back to that spectrum of self and identity, is you start to identify very strongly with those labels. And that can have a real negative effect because then you go out into the world saying, like, I'm Andy with OCD. I am OCD. I am anxious. I have this disease according to the DSM, the library of clinical diagnoses in psychotherapy and psychiatry. I am these labels. And that itself can become fundamentally limiting to your healing process and to the development of your sense of self. It's an over identification with something that at the end of the day is basically just used for a therapist to say, this person has a collection of these symptoms. These symptoms map to this diagnosis. This diagnosis has a clinical code that when I send that to insurance, they will reimburse it. That's what it's used for. But if you over identify with that, that becomes a limiting psychological construct. It's a new thing. I'm Andy, the person with a broken nervous system. I'm Andy, the person with these clinical diagnoses that they tell me are diseases. This is what I mean by the medicalization of the human experience. Maybe I'm just a hurt kid trapped in an adult body. And I had a very real human experience that billions of others have had as well. And maybe the thing that I need, other than some diagnoses that can come with stigma itself, and it's hard to, like, not philosophically fall into that trap. Maybe what I need is just a little bit of love and some healthier relationships to help me repair not only how I connect with others, but how I view myself. That's not a disease. I hope that answers the question.
Thank you for that final note, Andrew. And thank you so much for engaging with these questions. Thank you, everybody, for staying over.